How to read an ECG from the anatomy and lead positions. The human heart sits in the mediastinum and is shaped like a cone. It runs obliquely from right to left, and from anterior to posterior. The right atrium and ventricle form the anterior surface, while the left atrium and ventricle sit more posteriorly. The apex points downward, forward, and to the left, resting on the diaphragm. The precordial leads V1 to V6 wrap around the chest and view the heart in the horizontal plane. V1 and V2 look at the right ventricle and septum, V3 and V4 focus on the anterior wall, and V5 and V6 see the lateral left ventricle. The limb leads 1, 2, 3, AVR, AVL, AVF view the heart in the frontal plane. Lead 1 looks from the left, 2 and 3 look from inferior, AVL looks from high left lateral, AVF looks from inferior, and AVR looks from the right shoulder, giving a global 3D view. When electrical activity moves toward a lead, the ECG shows a positive or upward deflection. When it moves away, it shows a negative downward deflection. By knowing the anatomical position of each lead, you can interpret the direction of activation. For example, a taller wave in lead 2 suggests activation is moving toward the inferior heart. This principle helps localize infarcts, conduction blocks, and arrhythmias. The sinus node is in the right atrium near the SVC, and it discharges spontaneously, initiating each heartbeat. Conduction then spreads from the sinus node across the right atrium, through Bachmann's bundle to the left atrium, and down to the AV node near the septum. The AV node slows conduction, then signals travel down the His bundle, split into right and left bundle branches, and spread rapidly via the Purkinje network to depolarize the ventricles. Understanding ECGs through cardiac anatomy allows clinicians to precisely interpret the heart's electrical activity, linking waveforms to anatomical regions, and detect pathologies like infarction, hypertrophy, or conduction blocks by visualizing how impulses travel through and around the chambers of the heart.